Well, hey guys, today I'm going to be reacting to a TikToker who claims that topical retinols can worsen depression. I'm going to be going through the TikTok, sharing with you my thoughts on it, and I'm going to be going over the data on do topical retinols worsen depression, and what about the oral retinoid Accutane or isotretinoin and its association with depression.
Retinol is a depressant. So my psychiatrist and I were going through my medication list and she was like, "Oh, how long have you been using retinol?" And I said, "Oh, since I was a teenager, I used to have really bad acne." And she said, "Well, actually, that can make depression worse." You'll see all the skincare gurus on here telling you that it's so good for anti-aging properties and smoothing out your skin and for acne and stuff, but they don't tell you that. This includes over-the-counter retinols. So FYI, PSA, heard it from a psychiatrist.
This individual has expressed concern that applying tretinoin, which is a retinoid, to the skin might worsen their depression. There is some misunderstanding here. There is no association between applying retinoids to the skin and worsening of any mental health outcome, whether it be depression, anxiety. Tretinoin, which is what this individual is using, is retinoic acid. And retinoic acid is actually naturally present in our bodies. And applying it to the skin actually does not impact the levels in our blood, including acutely and when using it long term. The percutaneous absorption into the body is minuscule. But what's really important to know is that acne is a disease that at baseline, regardless of what is being done for it, has a high associated risk of mental health issues, a higher risk of depression, a higher risk of anxiety. It is a skin condition that has a high comorbid mental health burden that really needs to be addressed. The possible induction of depressive symptoms while on isotretinoin was initially noted in 1983 after anecdotal reports of worsening depression while on isotretinoin. In 1998, the US FDA issued a warning on isotretinoin, aka Accutane, of possible depressive symptoms, psychosis, and thoughts of taking one's own life. However, two large population-based studies, one done in 2000 and one done in 2003, showed no association with worsening of depressive symptoms or increased risk of taking one's life. And a meta-analysis, which looks at all of the available studies on an association between Accutane and depression, showed no association. And in fact, in that study, not only was there not an increased risk of depression, but actually their depressive symptoms improved while on Accutane, aka isotretinoin. Remember, you guys, acne is a disease that has a high comorbid risk of depression, anxiety, and other mental health problems. Another study similarly supports this idea in that new onset depression was no different between individuals being treated for their acne with isotretinoin versus individuals being treated for their acne with an oral antibiotic. Another study extrapolated data from end-stage cancer patients being treated with isotretinoin at a very high dose, actually 3 milligrams per kilogram per day. And they felt that perhaps those higher doses were more risky. And we're not using doses that high to treat acne ever. We use doses in the range between 0.5 to 1 milligram per kilogram. Some smaller studies do report an increase in depressive symptoms in the first few months of starting Accutane. But if you guys know anything about Accutane, which is isotretinoin, then you know that it takes some time to start working, and actually the acne can get a little bit worse in the beginning before it gets better. And so if you are an individual who is at increased risk for depression at baseline, you probably already have depression going into the study, and then we worsen your acne in the first few months, yeah, your symptoms are likely to get worse in the beginning. What do we know about the risk of depressive symptoms and isotretinoin? People who have acne are at an increased risk for having depressive symptoms. It is a depressing disease to cope with. There is a higher comorbidity of depression as well as anxiety. It's really important to take the acne seriously and to treat it not only to prevent scarring, but to impact how serious it can be on one's overall quality of life and their mental health. Large studies show no associated risk with taking isotretinoin and worsening depression. In fact, studies show that the depressive symptoms actually lessen because of Accutane. Having acne puts you at increased risk of depression, and anything that worsens the acne can worsen your overall quality of life and feed into more depressive symptoms. And because isotretinoin sometimes temporarily worsens the acne a bit and it takes some time for it to start working, it makes sense that in some cases, depressive symptoms may worsen in the beginning. So what that tells us is that, first of all, acne patients need to be screened from the get-go for mental health disorders and symptoms, and their mental health needs to take priority as part of the treatment of their disease, treating them as a whole, not just treating pimples. It's treating them as a patient as a whole. And mental health is a serious aspect of this disease, but I think it's something that needs more exposure, more talk around it, because the public still doesn't really acknowledge acne as a disease, let alone realize the serious comorbid association with worsening depression, and potentially taking one's own life. That is how serious acne can be. And so it really does need to be taken seriously. In the case of topical retinoids, there is no risk of worsening depressive symptoms with topical retinoids, whether it be the prescription kind or the stuff that you get over the counter in anti-wrinkle cream. So I know a lot of you guys use retinoids for other reasons. You don't have to be worried that these creams are going to worsen your depressive symptoms. But if you have acne, it's really important to realize that you are at increased risk for these mental health issues. And the treatments are likely guilty by association, because there's no studies to show that they actually cause depression or depressive symptoms, or worsen depression or depressive symptoms. The natural history of the disease is linked to depressive symptoms. When the acne gets worse, the quality of life gets worse, and the individual's mental health suffers, and therefore you have more depressive symptoms. Because we take the mental health piece so seriously, we screen patients from the get-go for these mental health symptoms, and we follow them very closely, especially in the early months of starting them on isotretinoin, aka Accutane, because in some cases the acne itself can get a little bit worse in the beginning, and so we want to be very careful that their mental health needs are being met during this fragile time while the acne may be getting a little bit worse or taking some time to clear up. If you think about it, a lot of people delay going to see a healthcare provider or a dermatologist. They put it off until things get really unbearable. And so you can imagine that if somebody is being started on Accutane, it's not likely that they went to the dermatologist after their very first 1 or 2 pimples. They've likely been battling and struggling, possibly in silence, with their disease for a long time before finally seeking help. And therefore, they may be already so far into the depths of their depressive symptoms that even more reason to get that addressed from the get-go, because a lot of times people are struggling in silence. The stigma around mental health, it's gotten a little bit better, but we're still not there yet. And people, especially teenagers, who are the largest population that copes with acne and is, going to be on these medications, teenagers are even more reserved about expressing their emotions. They're still maturing, and they're still getting a grasp and a handle on their emotions and expressing that. And so if you're a parent with a teenager with acne, I hope this video allays your fears that the medications are harmful and going to cause mental health problems. And instead, I hope this video illustrates to you that it is very possible that there is some potential struggles with mental health that should be acknowledged from the get-go. It really frustrates me that the media continues to sensationalize the association between isotretinoin, Accutane, and depressive symptoms, rather than talk about and shed light on the fact that there is the true association is between acne and depressive symptoms. That's really what we need to focus on, addressing the mental health needs of people with acne. When isotretinoin was discovered and first came out, it completely revolutionized how we were able to treat acne. We now have a medication that can effectively cure acne in many patients, and not only that, prevent scarring. It also has a variety of other amazing benefits to treat a variety of other diseases, but we obviously always think about it first and foremost as an acne medication. So the fact that the media continues to sensationalize and overemphasize this association between depressive symptoms and isotretinoin, but fail to bring to everyone's attention the fact that, hey, it's acne that has an association with depression and mental health, not the medications. They are guilty by association. They actually can help lower the depressive symptoms and prevent scarring that would otherwise go on to seriously negatively impact these individuals' quality of life. Curious about how the stay-at-home orders and the pandemic may have negatively impacted your self-image? On the next slide, I'm gonna have a video of me talking about this very topic, so check it out if you haven't already. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.